It's 8:40, News Radio 102.9 KARN. First News, Kevin Miller. I'm joined by Dr. Karl Boehme and Dr. Craig Forrest, Associate Professors in the Department of Microbiology and Immunology at UAMS. Good morning, gentlemen. How are you doing today?
Good morning. Doing well.
Great, Kevin. Thanks for having us.
Thank you for being on. You've got some interesting information about COVID-19 and what you put together. Tell me what's going on.
Yeah, so the study that we engaged in was a seroprevalence study. So this was a survey of blood samples from patients from across the state to try to see who has antibodies specific for the SARS-CoV-2 that causes COVID-19. Mm-hmm. And the goal of this was to find out really what the level of infection was across the state. The PCR testing that we see reported on a daily basis gives us an estimate of the active number of cases that are going on in the state, but there's so much asymptomatic spread going on with this virus that that may not give you the true count of how many people have had it in the state, and the antibody response sticks around well after the virus is cleared. So if you're a person that has been infected, didn't show any symptoms, the antibody response would stay around, and we could detect that.
You found some interesting differences across racial and ethnic groups, too. What did you find there?
Well, it is interesting. We found that black people or African Americans and the Hispanic population had a higher percentage of persons who had antibodies to the virus compared to Caucasians in the population. But we still think that there's a lot of work that needs to be done before we can kind of pinpoint why those differences exist right now.
Any theories why?
Carl, you take that one.
So, well, that's tough to say. So some of it could be sampling. If you look at the number of Hispanics in our study, it was relatively low compared to the other ethnic groups. And so anytime you have a change of one or two persons within a very small population, that can kind of skew the results. But there could be any number of factors. It could be, economic factors. It could be geographic factors. We know that for many other types of diseases, cardiovascular and heart diseases, there are, Hispanics and blacks tend to have a higher prevalence rate there, whereas other diseases like, say, hemochromatosis, there are, a higher prevalence in the white population. And so these studies are just being done, started now, and so hopefully we'll have some real reasons why down the road.
Talking to Dr. Karl Boehme and Dr. Craig Forrest, researchers at UAMS. Okay, as far as down the road, this study is not over. You're going to look at other samples and get a better perspective, as I understand.
Correct. We hope to monitor the infection rate over time throughout as the pandemic progresses through Arkansas. So our seroprevalence rate right now is still pretty low, about 3.5%, and we expect that to go up over time, especially as we head into the holiday season, as the weather gets colder and people are indoors more. We still got a long way to go, unfortunately.
Yeah. Where do we compare, or is there a way to know, with other states or other countries as far as the exposure to COVID-19 in Arkansas?
As we've seen from data across the country, it's really kind of a regional disease. You see, some areas of New York had very high seroprevalence, so a lot of people were infected there, whereas other places are lower. I think that we're on the lower end, but I think that we're probably pretty comparable to other states around us.
Very good. It's Dr. Karl Boehme and Dr. Craig Forrest with UAMS. Are you looking for people to be a part of this information, or are you finding them on their own? What's the connection with that?
We're doing it. We've got a couple of things going on. So one is we're just collecting what they call waste samples or remnant samples. So if someone has a blood draw, we can evaluate their blood for antibodies before that blood is just tossed out and becomes useless. And then we're also, UAMS is conducting a phone call campaign to try and recruit people that would like to be involved in the study. So if anyone out there gets a phone call, then please answer it and say yes, because we'd like to get a really good sampling of the state in terms of how many people do or do not have antibodies so far.
All right. It's Dr. Karl Boehme and Dr. Craig Forrest with UAMS. Good to have you both on this morning. Thanks so much.
Thank you very much.